Hello, and Happy New Year to you and your families. Wanted to wish you the best of everything in 2024. Welcome to today's webinar. My name is Elena Sturman. I am the President and CEO of the Glaucoma Foundation. Since our founding in 1984, 40 years ago, the foundation has been dedicated to improving the lives of people with glaucoma. We fund researchers who are working to find the key to the preservation of vision and reversal of blindness. We bring together specialists in other fields to work on the problem of glaucoma and encourage innovation and communication between scientists and clinicians around the world. Through our website, newsletters, and webinars such as this one, we provide news and education to hundreds of thousands of people in the US and abroad. Glaucoma diagnosis can be frightening and confusing. You may have many questions or not even know what questions to ask. I am thrilled to have Dr. Constance Okeke with us today for the webinar, I've been diagnosed with glaucoma. Now what? Our goal is to guide you and to empower you. Dr. Okeke will cover pivotal topics from unveiling hallmarks of good glaucoma care and effective doctor-patient collaboration strategies to actionable steps for managing vision loss. Dr. Okeke is a renowned cataract surgeon and a pioneer in micro-invasive glaucoma surgery, MIGS, with Ivy League training. She serves as Lead Glaucoma Specialist in Virginia Eye Consultants and an Assistant Professor of Ophthalmology at Eastern Virginia Medical School. She actively contributes to clinical research, peer-to-peer education, and publications in esteemed ophthalmology journals. Her dedication to patient education is evident through her AGE initiative, Advocates for Glaucoma Education. Her accomplishments have earned her the recognition of the Ophthalmologist Global Power List for 2021 and 2022. As always, at the end of our presentation, there will be a question and answer session. You can ask a question by using a chat button or a Q&A button, and we will do our best to answer as many questions as possible. Ladies and gentlemen, please welcome Dr. Okeke, and let's begin.
Hello. It's wonderful to have the opportunity to share with you information about glaucoma and, after having had a diagnosis, what to do next. Thank you, Elena, for the introduction, and it's a wonderful opportunity to be able to work with the Glaucoma Foundation on things like this that help patients who have glaucoma have a better understanding and get empowerment with their disease. Today, we're going to cover a number of great topics that I hope will help you feeling empowered and more knowledgeable and more secure about what you feel you can do to help protect your sight. We're going to cover what is glaucoma, what does it look like, how is it treated, and about familial associations. We're also going to talk about tips for maintaining healthy vision. We'll cover good glaucoma care. What does that look like? Effective strategies to work with your doctor, action steps for those with vision loss, good questions to ask your doctor, beneficial lifestyle changes, and talk about emotional and psychological support. So glaucoma, when you've been diagnosed with it, the thought of losing your eyesight can be really frightening, really heavy and daunting. And in that situation, one will really want to turn to where they can get information about this diagnosis, get more understanding so they don't feel as confused about what to do. The encouraging thing is that glaucoma can be treated, and we have a number of innovations that are happening all the time that help us to protect one's sight. And there's also lots of information that's available to you at your fingertips. I'd like to talk to you for a moment about how educating yourself is so powerful. It's powerful in the sense that I was so wanting my patients to have this ability to help take care of their eyes and be encouraged with information to feel empowered that I wrote a book called the Glaucoma Guidebook. It came out about a year ago, and I'm proud to say that it's won several awards, which is a testament to the information that's inside. I encourage you to consider getting that book. Another great resource is through the Glaucoma Foundation. They have a number of webinars like this one, things that are enduring on their website and on YouTube. They have newsletters, both in email and mailed out quarterly, that can be available to you. They also have education for professionals, and they also encourage young youth in high school and middle school to get encouraged about ophthalmology and glaucoma with a program they have with, called Start with the Young. So let's go into what is glaucoma. This is something that your doctor may have talked about a bit, but when I have someone in my office who has been diagnosed with glaucoma, I talk about how glaucoma is a condition that affects the nerve structure in the eye called the optic nerve. And if you look at the picture with the face and you see the eye, imagine that there's a section that's just cut right in from the front to the back of the eye. And you can see here in the picture that this is the eye, and the front of the eye we have here called the cornea, the curvature that's to the right. And then in the back of the eye, we have the structure called the optic nerve, which is circled. This is the area that's affected in glaucoma. Now, when I look inside someone's eye and I look at their optic nerve, a healthy optic nerve should look round like a donut with a nice thick rim all the way around. So what happens in glaucoma is that there's damage to this rim of tissue. And this rim of tissue is a finite amount. If it gets damaged, we don't have a way of growing it back or putting it back. And if you lose enough of it, it starts to equal loss of vision that's permanent. So when I look inside the eye, I can see signs of that rim of tissue getting thinner, as seen here, called the structural damage. When there's structural damage in the eye, as it progresses, it starts to equal blind spots. Here's a picture of what we talk about as functional damage. Very commonly in glaucoma and treatment and in diagnosis, we use a certain test called a visual field. In that test, it looks like the top where there's like a crossbar and there's a dot, and that dot is the natural blind spot. But all the other areas should look light gray in color, like it does at the top where it says normal visual field. What happens in glaucoma, as that thinning process of tissue damage occurs, you start to get these blind spots. And these blind spots usually start out in what we call the periphery or your side vision. And then they start to work their way in towards the center. So as you go down that picture, you see that the blind spots or the dark spots get more and more, and they work their way towards the center. That's what we're trying to prevent by treating glaucoma. We don't have a way to reverse that. So that's why it's so critical to get screened and diagnosed for glaucoma, stay in care so that we can try to prevent more loss. Now, it's very common for someone to say, "Oh, is that what glaucoma looks like? Like those dark spots?" Well, the reality is that there's a lot of literature that will try to talk about what glaucoma looks like, and they may have a picture of a normal visual field like here, or normal vision where you see everything, and then they'll say, this is what glaucoma looks like, which is an abnormal visual field, and usually there's some type of blur effect or darkening. I've had patients in my office who've seen patients like this, or who've seen pictures like this, people who I know have glaucoma, and they'll look at the picture and they'll say, "Well, I don't see like that, so I must not have glaucoma." And when I heard someone say that for the first time, I was very alarmed because I'm like, no. Well, one, I know you do have glaucoma, and I see that there's can be confusion about what glaucoma looks like. So I'd like to give you kind of a description of what glaucoma looks like and how it can be sneaky. So here you have a picture of someone, imagine someone driving. They're driving and looking through their windshield down the road. And imagine that they see here, you see in the bottom left, there's a normal visual field. And so this is someone's normal vision. They can see the ball in front of them. They can see the two children running after the ball. They can see down the road, cars on both sides, buildings on both sides. This is normal vision. Now you have someone who has glaucoma, and if you look at that visual field in the bottom right-hand corner in the middle picture, This is someone who has what would be considered early to moderate defect in the bottom to right hand side. And so when they look outside of their car windshield, they still see that ball. They still see well down the road. They see the different buildings on both sides, the cars. But what they're missing is that picture of the two children and some of that picture of the car. It's not that there's a black spot there, it's just that it's kind of blurred out. And that's what the brain does. It wants us to try to see our best. So it doesn't necessarily create an absolute black spot, it just kind of blurs the image, which is part of the reason why glaucoma is so sneaky, because you sometimes don't even know what you're not seeing, because in the central area where we tend to focus, it's very clear. So here's another picture of now a patient who has even more advanced glaucoma. And you can see in their visual field at the bottom left-hand side that there's a lot of dark spots. In the center, it's kind of clear, but those dark spots are definitely more. Now, this particular kind of patient may still feel like they see still pretty well because they can look all the way down the road and they can see the ball, they can see the cars at the end of the road and the buildings at the end of the road, but they don't realize that there's the blur of the buildings that are missing on the left-hand side. The car that was there in the front, the red car is completely gone. There's no view of any children. Some of the buildings on the on the right-hand side are blurred. And so this is what can happen in glaucoma. It can take away your sight in a way that's really slow and sneaky, which is part of the reason why follow-up care is so important so that we can do diagnostic testing to see if there's stability. And if things are changing, we can act to try to get more aggressive to treat and slow down the progression of glaucoma. So, how do you treat glaucoma? Well, all of the treatments that we have are all aimed at the problem of the eye pressure. We call it intraocular pressure. And think about in the eye, inside the eye, there is a structure that is always making fluid. This fluid is called aqueous humor. Just think it's like a faucet that's just always turned on. And what happens is that fluid is supposed to get out of the natural drainage system. So fluid is being made and fluid is supposed to flow out. And there's supposed to be a natural balance of fluid being made and fluid getting out. What happens in glaucoma is that there is a problem with the drainage system. It gets clogged. If you look at the picture, at the front part of the picture, there's a structure that's called the ciliary body. That's where the fluid is made. And if you follow that yellow arrow at the front of the picture, it shows the pathway of how fluid is supposed to be made and that it's supposed to get out of the drainage area that we call the trabecular meshwork. So if that area of the trabecular meshwork or the drain gets clogged and the fluid can't get out, well, the faucet still stays on. So now the fluid is building up inside the eye. But the eye is a closed system. So there starts to become pressure because the fluid can't get out. And as that pressure builds up, it's pushing against the walls of the eye and it pushes against the structure of the eye called the optic nerve. And as it pushes against that structure, it causes stress and then damage of those delicate fibers. And once they're damaged, they go away, they die, and we can't get them back. And like I said before, if you lose too many of them, it starts to equal loss of vision that's permanent. So right now, all of our treatment for glaucoma is aimed at trying to lower the pressure. Think about the pressure being stress, and as you lower the stress on the nerve, you protect it. So one way I like to kind of describe this whole concept of the glaucoma and the different types of glaucoma is through talking about the drain, the sink drain analogy. So you may have heard of the term open angle glaucoma and angle closure glaucoma. Those are the two most common types of glaucoma. And understand there are many different types, but those are the two most common. When it's opening a glaucoma, it's like the drainage system looks like it's supposed to be open, but somehow there's a clog deep in the pipes. So looking at this picture, you have A, which is a normal sink drain and a normal movement of fluid through the drainage system. You have the faucet that's turned on. You You have the fluid going into the sink. It's going down the pipes into and being able to be funneled out. So you have fluid being made and fluid getting out, and there's not a backlog of that fluid in the sink. In B, this is like open angle glaucoma. You have the faucet that's on, and you have the drain, and the drain from looking up above looks like it should be open, but what happens is that there is a clog somewhere in the pipes, and because of that clog, there is a backflow of fluid. Now, in the sink, it can spill over, but in the eye, like it's a closed system, it creates pressure. When we talk about angle closure glaucoma, also known as narrow angle glaucoma, this is when you can actually see an obstruction. So kind of like in a sink, if you have a stopper and it's pushed down, you can see that the stopper's pushed down. That's like angle closure because we can actually see an obstruction where the drainage system is. We can see that it's blocked by tissue. And so depending on the type of glaucoma, there are different treatments. So glaucoma can be its treatment can be kind of sectioned into three areas. The first area is medications, typically in the form of eye drops that need to be used on a daily basis. Then there's the option of what we call light energy treatment. People can also use the term laser, but there's different types of wavelength of light that are used for different types of glaucoma. And then there's also incisional surgery where some cutting is involved, and this is more mechanical. We're either trying to flush out and clear out your natural drainage system, or trying to enhance your natural drainage system, or creating a whole new drainage system. So with medications, we have different classes of medicines. You may be familiar with these if you're on eye drops. Typically, there are different color tops. These different color tops help us to understand which class of glaucoma drop it is. And it's used to help communicate because sometimes naming the drops can be difficult, but if we know the color top, we know what class of medicine it is. And one can use one or maybe many drops, and they should work synergistically together. But the important thing about medications is that they need to be used regularly. They can't be stretched out or just used one day and not another because their effectiveness only lasts for so many hours. And so they need to be used consistently. And so that's why it's really important to keep up with your regimen, or if there's any problem with your regimen, to talk to your doctor and let them know so you can come up with the best solution to trying to keep your eye pressure and your glaucoma under control. When we talk about light energy or laser treatment, like I mentioned before, there's different types of treatment. There's different wavelengths of energy. Some light energy laser is actually cutting. We can make a incision within tissue or make an opening within tissue. That's like a laser peripheral iridotomy, which is a common treatment that's for narrow angle glaucoma. Then there's another type of light energy treatment called SLT or selective laser trabeculoplasty. This is a very common treatment for open angle glaucoma. This kind of light energy does not cut or burn, but it stimulates a reaction in the natural drainage system for it to be more open so fluid can flow more easily, and that helps to lower the eye pressure. Then there's also another type of laser called argon laser trabeculoplasty. This is not as commonly used as SLT. It was found or created before SLT, and it uses more of a warm or a hot energy. And because it can sometimes cause some scarring, it's not something that can be repeated. But the SLT is something because it's so gentle, can be repeated multiple times to help lower the eye pressure. Then there's another type of laser called laser cyclophotocoagulation. This is a type of laser that's used in order to treat the area of the eye that makes fluid. By applying this type of laser, it can actually shut down or turn down the faucet so that the drainage system can handle the load of the fluid more easily. Now there's also, like I mentioned, a third type of treatment for lowering eye pressure, which is incisional surgery. And we have several different types of incision surgery. There's a certain area that we call MIGS or micro-invasive or minimally invasive glaucoma surgery. And this is something that has really exploded over the last decade. It is treatment that is less invasive and that it's trying to help your natural drainage system to function better. So not necessarily creating a new drainage system, but helping your natural one to get unclogged and function better. Then there's another area of glaucoma surgery called LIGS, or less invasive glaucoma surgery. This is a little bit more invasive than MIGS, but it's less invasive than the traditional glaucoma surgeries. And we're using devices that help us to create simple new drainage systems. Then you have your trabeculectomy and tube shunt. Now, you may have heard of these terms. These are some of the oldest types of surgery that we've been using for decades, and they are still well utilized, but they tend to be utilized in more advanced glaucoma when other procedures or treatments have not worked as well. One can use these and try to get the pressure down low. There's a little bit more of a complexity in these types of surgeries, so they're not always the ones to go to as a first line. So, another important question is, does glaucoma run in families? The answer is yes. Glaucoma definitely runs in families. And when we talked before about how glaucoma is really sneaky and that many people don't know or realize that it's happening because it's so subtle, it's been found that about 50% of people who actually have glaucoma don't know it. And one of the highest risk factors is having a family history. Other high risk factors are increasing age as well as race. Open angle glaucoma is more common in people of African descent, African Americans, and also Hispanic descent. Narrow angle glaucoma happens to be more common in Asian populations. But 50% of glaucoma is familial. And so 1 in 8 of relatives of glaucoma patients will have glaucoma, and many of them will not know it. That's part of the reason why it's so important. If you have a diagnosis of glaucoma, you should tell your family members. You should let them know and share in the care because you want to help them protect their sight. And the only way for one to get diagnosed with glaucoma is to get checked and have an eye evaluation. And so it's really important to not shy away from telling them because you don't want to give them, quote unquote, the burden of your diagnosis, but to tell them, to be an advocate for them, to make sure that they can take good care of their eyes. Because the earlier that it's detected, the easier glaucoma is to treat. So, how do you protect your sight? Well, the first tip I'll give you is to talk about what good glaucoma care looks like. It's really important for you to find a doctor that you have confidence in. Why is that important? Because your doctor is going to be giving you suggestions of treatment for you to do. And it is, you need to have a confidence in what the doctor is saying so that you will be able to follow those recommendations. If you don't feel confident in that doctor and you choose to maybe do something or not do something, or you don't feel comfortable talking to the doctor, then that can be a problem for you in your treatment for glaucoma. And it may be very important for you to find a doctor that you feel confident and trust in so that you can have your best eye health. And that might sometimes mean getting a second opinion. A good doctor-patient relationship, you feel like you're listened to, that you can when you ask questions, that they respond to them and to respond to your concerns, and that they explain the treatment options at a level that you feel that you can understand. That they're also available for follow-up checkups and calls. Now, I will say that as we get busier and busier with patients, sometimes there is a share in the care for teams in order to help take care of patients. But that is an approach where everybody on the team communicates well and you feel well taken care of. So, how do you effectively work with your doctor? Well, it's very important that you keep track of your appointments. Glaucoma is a chronic condition, it doesn't go away. And so, if you've been diagnosed with it, you're going to be needing to see someone fairly regularly in order to make sure that things are stable. Even if you've had surgery, even if you've been on drops for years and your pressure's always been stable, things can happen with glaucoma. Glaucoma can change all of a sudden. And if you don't have that follow up care, you may have a gap where you can lose vision, lose nerve tissue, and not be able to reverse that or get it back. So that's why it's important to keep track of your appointments and know that you need to follow up regularly. Now, sometimes there may be things that happen. Life happens. Maybe there's a appointment that you have to miss, or the doctor calls and has to cancel. And sometimes the rescheduling of that appointment can get kind of fuzzy. It's still important for you to know that you need to stay on top of your appointments. Don't think that, oh, my doctor didn't call me, so therefore I just must not need to be seen. No, it's your eyes, and you need to make sure you take care of them. Sometimes, like I said, it's not always a perfect world. Sometimes things can slip through the cracks. Know that you need to have follow up, know that you need to be seen, and know that you can call to make that appointment if they've missed it. Also, it's important to write down your questions. In between your office visits, sometimes something might happen. It's good to jot it down so that when you do see the doctor, you can have these things to talk about and not say, oh, what did happen? I forgot that. You know how you go to a doctor's office and you know you were supposed to talk about something and you talked about everything else and then you left and then you're like, oh, I didn't get a chance to. So it's important to write those things down. And also, it's important to let your doctor know if there's any problems. If you have a problem with the medication, if it costs too much, if it irritates your eye and you do not want to take it, if it is the regimen is so difficult for you to keep up with and you know you're forgetting a lot, you need to tell the doctor. We know that patients want to do the best and comply with what their suggestions are, but we also know life happens and we make our decisions based on what we think that you're doing. If you are not using the drops or stretching your drops because they're so expensive or they're irritating your eye. And then we see that, oh, the pressure's not where we want it to be, or oh, there are changes on your tests. Let me add more drops. Well, the solution may not be adding more drops. Maybe it's changing the class of medicine. Maybe it's figuring out a drop that you can afford better. Or maybe it's a different mode of treatment. Maybe a light energy treatment might be better. Maybe you're actually needing to have a certain type of minimally invasive glaucoma procedure. So these are things that are very important for you to feel open about, to talk to your doctor about for your own health, so that your doctor can come up with the best plan. Together, you can come up with the best plan that will work for you to be able to maintain your vision. What do you do if you still have some type of vision loss? In glaucoma, people can have vision loss that's noticeable. And so the first thing is to do is not lose hope. There are ways in order to enhance even impaired vision. There's something called low vision evaluations. And if you haven't heard of that, you should mention it to your doctor if you have vision that you feel is impaired. There are certain type of specialists called low vision specialists that are trained in order to know about aids and things that can be used in order to help enhance the limited vision that you may have. They may be magnifying glasses. They may be knowing how to change the lighting system in your house to get the best contrast so that you can see your best. They may be certain devices that help to allow you to do certain activities like check your mail or write checks. These are tools that they have in their offices for you to try so that you can figure out which aid might help you with certain functions. So it's very important to be able to have access to that. If your doctor doesn't know of a good low vision specialist, you can go online and look up low vision specialists in your area. Um, Also, it's really important to get involved in support groups. Support groups are found if you look for them. There's support groups through the Glaucoma Foundation. There's support groups through things like Facebook groups and different types of Reddit is another area of an online focus group for patients with glaucoma. I found even that sometimes my office acts as an area for support because I see quite a number of glaucoma patients, and it's very common for patients to talk to each other and sometimes get encouragement from talking to other people who've been through their experiences. Maybe it's a new patient who hasn't seen me before, and other patients talk about their experience with me and put them at ease. Or maybe it's a procedure that someone's had and they share their experience and make a person feel more encouraged. So sometimes that can even be an area of support. But it's important to find ways to share your experience because you're not alone. And sometimes glaucoma can be a very lonely type of disease if you let it. But if you share your experiences, you can feel more normalized and you can feel encouraged. And it's important to talk to your family. Let them have an understanding of what's going on so they can also support you your best. So, what kind of things should you ask your doctor? Well, there are certain good questions that you can ask your doctor, like, what kind of glaucoma do I have? What's my target pressure? That term target eye pressure is something we use often because it's something that we assess to give us a sense of where your eye pressure should be and if we're in a good place for where we think the stage of your glaucoma is. What are your treatment options? How often do you need to be followed up? Typically with glaucoma, if you're not under control, someone might see you, every so many weeks. But if you're under more stable glaucoma, your glaucoma is more stable, but maybe you have advanced glaucoma, we want to see you a little bit closer, like maybe every 3 months. If your glaucoma is more mild or moderate, maybe you need to be seen every 4 to 6 months. If you're just someone who's a glaucoma suspect, maybe every 9 months to a year. So it depends on the stage of your glaucoma, depends on your control level, and it depends on just where you are to get a sense of what your follow-up should be. So that's a good question to ask your doctor. And if there are any activities that you should avoid. This can sometimes be more pertinent if you've had a certain procedure. And what other recommendations can think of or consider? Well, there are some certain lifestyle changes that are beneficial to people who have glaucoma. It's important to take care of your overall general health. I mean, this helps your eyes. So if you exercise, that increases blood flow to the optic nerve. That's good. If you eat healthy, that's excellent for your eyes. There are certain foods like green leafy vegetables, which are rich in nitrates, which are excellent for helping enrich the optic nerve. Also, citrus fruits have been found to be very helpful for glaucoma. And so you should also reduce your stress and try to relax. It's good to do things that you enjoy. Just because you have glaucoma doesn't mean that you have to limit yourself from doing things like reading and having pastimes where you travel and see enjoy certain cultures and new sites. It's important to reduce your stress level and continue to enjoy life and living. And then sometimes it's good to take vitamins. There are a number of vitamins that one can take that can help with the overall eye health, but there is a certain vitamin called the optic nerve formula. This is made by Science Based Health, and it has components in it that have been shown to increase blood flow to the optic nerve. So, this is something as a supplement that I often suggest to my patients who are being treated with glaucoma, who want to do anything extra that they can, or if they have aggressive glaucoma and I want to, outside of lowering their eye pressure, do something else to help supplement the health of their optic nerve. And when talking about the emotional side of glaucoma, I touched upon this initially already, is to not do it alone. Your feelings are important, and it's important to be able to share those with others. I've had sometimes patients who have felt frustrated with family members who say, that although you can't see, somehow you can see, that thing on the floor that's over there? How is it that you're not seeing well, but you can see something that's way ahead of you? Well, the reality is that glaucoma, sometimes you can lose all this peripheral vision, but you have really good central vision. So in that little small area, you could see all the way across the room. But if someone comes to shake your hand, you could miss that hand because it's in an area where you're not seeing. So having these discussions, sometimes, like I said, bringing it up in the clinic setting has helped some patients understand. Sometimes there's actually a section in my book called the Caregiver Guide that has some information about how family members can have a better understanding of what's going on with their glaucoma family member so that they can help them relate to that glaucoma better. Also, it's important to just keep educating yourself because knowledge is the power. And when you feel empowered with knowledge, you feel like you can take action and you're a little bit more in control of understanding what you can do to help to maintain your sight. And that's where you can get more education. Like I mentioned, the Glaucoma Foundation has online support groups. They have a comprehensive patient guide that's called Doctor, I Have a Question. That's very helpful. They have certain funding for research, and they have programs that help to support ongoing assistance for patients. And they also participate in public service announcements. So the Glaucoma Foundation is an excellent resource for getting education and staying connected. Earlier, we mentioned the AGE initiative. So this is an initiative that began last year called the Advocates for Glaucoma Education Initiative. And it's really an initiative for people who are wanting to stay educated about glaucoma and empower other people to learn. I know we're in January, which is Glaucoma Awareness Month, but we really need to be educated about glaucoma all throughout the year. And the Glaucoma Guidebook is the foundational resource for the AGE initiative because it's a great foundation of knowledge for education and empowerment to feel more confident about treating glaucoma or knowing what you can do to help protect your sight. So I encourage you to be involved in the initiative. Encourage you maybe getting the book or suggesting it to a family member or friend. And also just follow us on social media. We have hashtag Age Initiative on LinkedIn and YouTube channel, the iGlaucoma YouTube channel. And then also I want to just mention that if you are interested in getting the book, there's a discount of 30%. You can scan this QR code or go to the glaucomaguidebook.com and find access to getting the book there. And just to kind of give a sense of what's in the book, I wrote this book, like I said, because I had patients who came into my office who had glaucoma and they might have heard about it before, but didn't realize the gravity of the diagnosis. And now seeing them later, they've lost a lot of vision, and all I can do is try to maintain. I can't go backwards. So the book was designed in order to give a good understanding of what glaucoma is in terms that you can grasp so that when you hear them in the doctor's office, you understand what they mean. But it wasn't meant to be over your head. It is very conversational, easy to read so that you feel informed. And then the second part of the book is expert tips. Some of them I mentioned today, but things that I want glaucoma patients to know, I wish every glaucoma patient could know so that they can be a strong advocate for themselves and taking care of their eyes. And then also, because I know about the support aspect, I wanted it to be something that was well-rounded. So I asked 5 of my glaucoma patients to share their story. And in sharing their story, people can be encouraged, people can feel that there's someone that they can relate with, and they can also learn about how to take advice and sometimes deal with glaucoma in ways that were mentioned in the book. And then there's resources in the back that help, like I mentioned, the patient caregiver guide, and then also resources for how to get more information when you need to take a deeper dive, vetted resources that you can look into for more information. So I know that it's one thing to talk about this book and why I wrote it. It's another thing to read someone else's words after they've read it. And this is a patient who had read the book, and this is what they said. This book is a must have, must read, not only for patients, but those who accompany them along this path. I highly recommend this book as a must read and simply chock full of information and patient experiences. Dr. Okeke breaks down an expansive amount of content into palatable bites. These bites are pure gold that give patient a firm, realistic understanding of the lifelong journey that comes with a diagnosis of glaucoma. Being informed is the first step towards accepting and living a full life with this disease. Having the Glaucoma Guidebook in hand will ensure an understanding to take those steps, one step at a time, one day at a time, as advances in the understanding of this disease continue. So in conclusion, living with glaucoma can feel like a daunting task, but the focus is to get educated, then take action and get support. I challenge you to try one or more of these tips that we talked about to better identify problems and provide solutions to aid in the prevention of blindness and live your best life in spite of glaucoma. Thank you.
Thank you so much, Dr. Okeke, for this really great, very informative webinar. I hope that our audience feel really empowered after listening to you. And they have been writing a lot of questions. So we have still a little bit of time to try to answer some questions. So let's start. So the first question was, I'm just scrolling back up to all the questions. Here's the question. Thank you for writing your book. Is your book available through audio format? Thank you.
That's a great question. It's not available in audio format at this time, but it is a project that we're working on for 2024. So stay tuned.
Thank you very much. Here's the next question, and it's about the drops, and I hope that it's okay to ask you a question.
One other comment. It is available on Kindle. So I know that sometimes there are programs on Kindle books where you can allow for a audio ability for of the phone to read print. So that's an option, but we don't have an actual audio version yet. Thank you.
Thank you very much. So here's the question, Dr. Okeke, about the drops. The Lumigan drops have caused the area under both of my eyes to darken. Is there any effective treatment to lighten this area?
Well, the reality is that that's a very common side effect of hyperpigmentation in the skin around the eye. Um, the ability for it to start to go away would include you stopping that drop. It is something that can lighten if you stop the drop. And so it's something that you need to discuss with your doctor as an option, if there are other options of medications that you can consider. Um, so that's how I would address that.
Thank you very much. Next question. What about the risk of IOP that is too low, like averaging around 8? Any suggestions there?
So sometimes eye pressure, the target for eye pressure can actually be in single digits. So a pressure of 8 might actually be a wonderful pressure. One of the ways that we know if a eye pressure is too low is how the eye is responsive to that pressure. When looking on a slit lamp exam or an exam in the office with the microscope, we can see if there are wrinkles in the eye. Okay, if like just like a balloon, if you let go of too much air, it gets kind of wrinkled. So if the pressure is too low, we could see those wrinkles, and those wrinkles can affect the vision. So typically, if you have a pressure that's in the 7, 8 range, that might actually be a great pressure, as long as you're not clinically symptomatic, and that's something to discuss with your doctor.
Thank you very much. Next question. Do you think it's a good idea to use eye drops if you're a glaucoma suspect, but have not been diagnosed with glaucoma yet? My
So,
father has a severe glaucoma. Sorry, I didn't finish reading. So it's somebody who is a suspect, but who has a family history.
mhm. There's two schools of thought. One is that not everybody who has glaucoma will pass it on to the next generation. Okay, and so you may be a low suspect, even though your father had a significant glaucoma, or maybe you might be a moderate to high. This is something that you can discuss with your doctor in terms of what level of risk you're at. Now, if you are at low risk, then being observed regularly, looking for any signs of change, can be a fine way to go without having to start treatment. If you are someone who is just very anxious and you will feel more reassured if you were using some type of treatment, one, you can consider taking vitamins. I mentioned earlier the optic nerve formula vitamin. That's a supplement that can be used in order to help. You can also do the lifestyle changes like certain types of foods, like the citrus fruits, the green leafy vegetables, the making sure you exercise. Those are things that you can do that help to support a healthy nerve. Now, I have had on very few occasions where someone was more at a higher risk, but a suspect, but maybe their pressures were kind of borderline, but they still had healthy enough nerves, normal diagnostic test, but they were a very nervous person. And you could consider talking with your doctor, maybe being prescribed a drop that is affordable, that is effective, and that is very soft or gentle on the eye, that you tolerate well, and to take that medication because sometimes being on the little bit more aggressive side if someone is high risk is perfectly okay as well. So that's something that you can kind of discuss with your doctor, but there are options.
Thank you very much. Next question. Is there a relationship between cataract and glaucoma?
So they are it's definitely separate. Can there be a relationship? Yes. So we talked earlier about how glaucoma affects the structure in the back of the eye called the optic nerve. Now, in the front part of the eye is a structure that's called the lens. Now, the lens, just like the lens of glasses, is clear when you're born, and as you age, naturally that lens starts to get a bit cloudy. Once it starts getting cloudy at any level, we call that a cataract. Now, a cataract doesn't just get cloudy, it can also grow in size and shape, kind of like layers of an onion, getting larger and larger over time. In some people, not everybody, but in some people, the cataract can get so large that it can have an effect on the natural drainage system and start to cause a clog or a blockage of the drain, opening of the drainage system. And so, in that scenario, yes, the cataract can have an impact on a relationship with glaucoma. And sometimes one actually needs to take the cataract out in order to prevent that closure of the drainage system. And so it can sometimes even be seen as part of the treatment for glaucoma. But they are separate areas of the glaucoma gets damage to the optic nerve, and the cataract is a structure that can get cloudy. But yes, the cataract can actually cause a obstruction of the drainage system, which can indirectly then make the glaucoma worse.
Thank you very much. Next question, is the Glaucoma Guidebook available in large print or digital format?
So it is available in digital format where the print can be enlarged, but we don't have actually, there's a hardcover and a soft cover, but they're normal print. So the best opt would be to get the digital format and increase the size there, like with a Kindle.
Thank you very much. Next question. Can you talk about the prevalence of people with sensitivities or negative reactions to the preservatives in the drops? Also, do you think some of the newer drops will eventually be made into the preservative-free version? Thank you. Such a great presentation.
Thank you. So there are a number of eye drops that are what we call kind of like gentler on the eye, because there are people who have allergies to some of the preservatives in the drop. The most common preservative that's used in topical eye drops is called BAK. That's the shortened version. And BAK allergies are quite, no, I won't say they're prevalent enough where one can have some irritation to the medication. And so there are eye drops that are preservative free. There's a class of eye drop that's in the what we call prostaglandin analogs. Prostaglandin analogs are the class of drop that have a turquoise top. They're typically once a day, once in the evening. There is an available medication in that class that's called Zioptan that comes in vials. And that is a preservative-free prostaglandin analog in that class. And so that's something commonly used in patients who need to have something that is either without the preservative or they just have irritations and want to have something that they can tolerate better. There's also a new preservative-free medication in that similar class of medication. I am escaping the name of it. Um, oh, there's so many new medications that are coming out. I'm trying to look to see. I just saw it. See, IUZA. So IUZA is one of the, it just came out within the last, I think 6 months, but IUZA is lantanoprost, which is one of the most common medications in that class. It's the preservative-free form. And so that's something that can also be used. They also have other classes of medications like dorzolamide timolol, or also known as COSOPT, that comes in a preservative-free form called COSOP PF. It also comes in a generic dorzolamide timolol preservative-free. So that's another class that can be used. And then there's also timolol, Timoptic and Ocudose. That's a beta blocker class that also comes in preservative-free. There are some medications that are not preservative-free, but they have a gentle preservative. Alpha-GAN P has a preservative that's a bit gentler on the eye, and so sometimes that class of medicine works well for patients. Um, Travatan Z. Sometimes it might be a little bit more difficult to get the name brand, but that had also gentler preservative in it. That wasn't BAK, that can sometimes be helpful. So within those different types of medications, one can try to use those to try to help to lessen the preservative. Also know that one can consider using other treatments, like there's a treatment called Durista. Durista is a class of medicine that is in the prostaglandins, like I mentioned, the teal colored top. This Durista is an implant that goes inside the eye. It is something that dissolves over time, and so it can last for even up to a year, sometimes more than that. We place it in the eye in the clinic setting. It's something that just takes a few minutes to do, but it is something that can also create a reduction of eye pressure, but then it's preservative free and it's not a topical drop that you have to use every day. So that's a benefit there. And then, like I said, other procedures like light energy treatment can sometimes be an alternative to help lower the eye pressure, reduce the number of drops that you're using. So there's a number of different options. It's just important to talk to your doctor about that and knowing that there are options.
Thank you so much for these really great answers. And next question is sort of a follow-up on the question before. How do doctors decide which drops to prescribe? And
So,
who's a
so,
good candidate? Sorry, who is the good candidate for the surgery? So it's a two-part question.
so, a lot of it has to do with the individual patient because as I was talking, there's a lot of different options that could be present. So, for example, how do I choose a drop? If someone has a BAK allergy or there's a lot of sensitivities, I might choose to try to steer them towards a preservative-free drop or try to lessen the load by considering other options like the SLT laser treatment, light energy treatment, or even a minimally invasive glaucoma procedure. Let's say, for example, if I'm seeing a patient and they're already on two eye drop bottles and their pressures are not well controlled, and I can see that they have a lot of ocular surface irregularity, irritation, dry eye, red eyes. Um, Considering putting them on another drop, I might be hesitant because I already see that they have a problem with the topical drops. At that point, I might need to, if I need to lower the eye pressure more, the options could be to add another drop, consider a certain type of laser treatment, or maybe they're a candidate for surgery, especially if they have a cataract. If someone is on glaucoma drops and they have a cataract that starts to get visually significant, they're a great candidate for considering a combined procedure where we can take the cataract out, put a new lens in to help them see better, and at the same time, while we're in the eye, we can do a MIGS or a minimally invasive glaucoma procedure that can help to lower the eye pressure. So after the surgery, they don't have to use as many drops, maybe sometimes even get off all the drops completely. And so everything kind of depends on what's in front of us. We really have to have all these options so we know how to tailor it to the individual patient. And that's why communicating with your doctor is so important because sometimes it's the communication that allows us to lead to really the really best plan when we know where your issues are and we try to figure out what can help minimize the issues yet still control your glaucoma.
Thank you very much. Next question. I've been told I have a pigmentary glaucoma. Can you tell me what it is?
So pigmentary glaucoma is a certain type of open angle glaucoma. And in your eye, you have pigment. So the part of your eye called the iris, which gives you the color of your eye, that is where pigment lies. And naturally, as your eye moves with light, you know how your pupil gets larger and smaller depending on the light, a little bit of that pigment will slough off. And that's normal. That just happens, but it happens very minimally. When people have pigmentary glaucoma, that pigment release is a lot more. It just sloughs off a lot more quickly. And so those pigment little particles, they eventually need to get out of your natural drainage system. And so you can imagine that as they're trying to get out of that natural drainage system, over time, they can start to clog that drainage system. And because they're clogging the system, the fluid can't get out well, and your pressure can start to build up. And so pigmentary glaucoma, there are certain treatments. Sometimes they might include certain types of laser treatments. Sometimes you might need to, again, use medications or sometimes surgeries in order to help treat it. Whatever the stage of your glaucoma can help determine which procedure to do.
Thank you very much. So we have time for one more question. So this will be our last question of this webinar. I have an open angle glaucoma. I heard that yoga should be avoided and gulping large amounts of water should be avoided. Any thoughts?
So, yoga is something that when you're in a position where your head is below your waist, you can induce pressure in the eye. Now, yoga can also be seen as a good form of exercise to help increase blood flow to the optic nerve. If someone is a yoga instructor where they're doing a lot of yoga, and someone has glaucoma, one might have some concern because of the amount of time they're spending with their head below their waist. But doing yoga on um, uh, daily basis for an hour, 45 minutes, or that type of exercise is usually typically something that's okay. But again, I don't know what your stage of glaucoma is. It's something to bring up with your doctor who can assess the stage of your glaucoma and assess whether or not it's something they feel that that's comfortable for them as they're monitoring you, or something that is something you should have to limit.
Thank you very much. So we've reached the end of our webinar. I want to thank Dr. Okeke again so much for this very informative presentation. And I really do hope that our audience feels empowered and gains so much more knowledge after this webinar. I also urge everybody to go and buy Dr. Okeke's book and read more about what you need to know as a glaucoma patient. And I also encourage you to stay connected with the Glaucoma Foundation as we offer so much information to you as well. Well, have a wonderful evening and bye, everybody.
Bye bye. Thank you.